Hi folks, we're just going to talk about cardiac cycle and pressure changes inside different chambers of the heart during cardiac cycle, and that's it. So it's not going to be a very detailed video, it's just going to be a recap or refresh to whatever you already know. It's like a review of the information that you already know. So let's just dive right in. Let's start with the cardiac cycle. As we know, we have a couple different phases for cardiac cycle. We have atrial contraction, ventricular contraction, ventricular relaxation. And atrial contraction is demonstrated as a P wave on the EKG, ventricular contraction as QRS complex on the EKG, and then ventricular relaxation as a T wave on the EKG. So during atrial contraction, we have to also talk about some valves of the heart. So we have a couple different valves here. We have a tricuspid valve and mitral valve. These two are known as your AV valve, atrioventricular valves. And then we have a pulmonary valve right here, and then we have a aortic valve right here. These two. That's going to be your semilunar valves. Okay. So during atrial contraction, both of your AV valves is going to open up. So your tricuspid and mitral valve is going to open up, letting the blood come into the ventricle. That's when the blood fills up the ventricles. And at this time, ventricles are not contracting yet. But once the ventricles are contracting, then these tricuspid valve and mitral valve would close so that the blood won't go back into the atrium. And that's when you hear the first heart sound, which is love. So you hear the heart sound when the valve closes, not opens. So your first heart sound is the AV valve closing, and that's going to be your systolic heart sound. It's going to sound like a love. So the ventricles are contracting and the ventricles are done contracting. When the ventricles are contracting, the atria, so ventricles are contracting. So at that time, the atria is relaxing. But we don't see the atrial relaxation on the EKG because it's going to be happening right when the QRS complex is happening. So it's buried underneath the QRS. So we don't usually see atrial relaxation. And when the atrial relaxation is done, the ventricle starts to relax. And that's going to be your T wave. So when the ventricles start to relax, there comes to a point where it's completely relaxed so that the pressure inside the ventricle, it's lower than the atrial pressures. So what happens is your tricuspid and mitral valve would open, letting the blood passively go into the ventricles. So it's not, the atria is not contracting yet, but the blood is still going into the ventricle passively. And that it's up to like 70% of your preload is passively goes into the ventricle. And the rest 25% to 30 to 25% comes with atrial contraction. But one thing I forgot to mention is when your ventricles are relaxing, there comes a point, okay, the ventricles are relaxing, there comes a point where the ventricular pressures are lower than the aortic pressure and pulmonic pressure. So the right ventricular pressure is lower than the pulmonic pressure, and the left ventricular pressure is lower than the aortic pressure. So what happens is the blood would start to flow down, right? To prevent that, the semilunar valves would close, and the pressure changes makes the valve close. So when the semilunar valve closes, that's going to be during ventricular relaxation, not complete relaxation, but partially relaxed. That's going to sound like dub. That's going to be your second heart sound, sounds like dub, and it's going to be your diastolic heart sound. And the cardiac cycle goes back, so passively filling the ventricles. After that, the atrial contraction happens. Rest 25 to 30% of the payload comes into the ventricles. So that's what happens during cardiac cycle. Okay, let's move on to the pressure changes inside the heart. If you look at the different pressure waveforms that we have here, it shows different parts of the heart. The yellow line is going to show your atrial pressure, as it says right here. The green line or green wave is going to show your ventricular pressure, particularly your left ventricle, because the pressure is so high, up to 120s. So that's going to be your systolic pressure. So that's why it's left ventricle. If it's like between 25, if the waveform was like this, between 25 to 15, then it would be right ventricle, because right ventricular systolic pressure, or the peak pressure the right ventricle has during contraction is like 25 in a normal person. So yeah. And then we have a red wave. That's going to be your aortic pressure waveform. We are missing pulmonary artery pressure. It's going to be similar to the aortic pressure waveform, but it's going to be lower value. If you look at the aortic pressure waveform, it's up to like 120s. So one thing I want to point out here is that your left ventricular systolic, your aortic pressure is going to be your left ventricular systolic pressure. So whatever your left ventricle achieve with the contraction, that's going to be your systolic blood pressure. They're going to correlate. So the same thing with the right side of the heart. So if your right side of the heart ventricle is going up to like 25, then the pulmonic artery pressure would also be 25, but it would look like that. It would look like that pressure waveform, but with the smaller pressure numbers. I have a little higher here, but it's usually 25 here. But I will explain everything. Okay. So moving on. So if you look at the yellow waveform we have here, we have a couple upstrokes. So this is going to be the first one, second one, and third one. And we have some slopes. This is going to be our first slope. This is going to be our second slope. Each upstroke and slope has different meanings. Each of them indicates different phases of cardiac cycle. So let's get into that. So if you look at the atrial waveform right here, there's a rise in the atrial pressure. That means the atrial pressure is going up, and that is because of the atrial contraction. So this first upstroke is going to be known as A, which is going to be atrial contraction, which is going to be P wave on the EKG, and atrial contraction on the cardiac cycle. Okay. So the blood is going into the ventricles, and then you see another upstroke right here. That's going to be our C wave. What is C wave? If you look at C wave, it's right underneath the ventricular upstroke. So that means it happens during ventricular contraction, and there has to be something else right here. That's going to be your valve closing. So the C wave indicates ventricular contraction and mitral valve closing. Sorry, my bad. Mitral valve is on the left side. It's going to be tricuspid valve. Tricuspid valve closing. So the C wave is going to be ventricular contraction, tricuspid valve closing right here, tricuspid valve closing, and ventricular contraction of the cardiac cycle. And it's going to represent QRS complex on the EKG. And if you see the next phase of the atrial pressure waveform, we have a slope right here. That means pressure inside the atria is going down, and that means the atria is relaxing at that time. And if you look at the ventricular pressure, the ventricles are still contracting, but the atria is relaxing. So, and we don't see atrial relaxation on the EKG, so we can say which wave on the EKG shows atrial relaxation, because it doesn't show on the EKG. It's buried underneath the QRS complex. So atrial relaxation, I think it happens around here and here. And if you look at the waveform here, it's slightly going up. So that means the pressure inside the atria is slowly going up for some reason. And the reason is the atria is filling up with blood, whatever blood coming back into the heart. So to the right side of the heart, it's coming from the rest of the body. Left side of the heart, it's coming from the lungs. And it goes up to a point right here where the ventricular pressure is coming down as well. So if you look at the peak here, that's going to be known as your V wave. Okay, and at this time, the ventricular pressures are lower than the atrial pressure. Okay, so since the atrial pressures are lower than the ventricular pressures are lower than the atrial pressures, this pressure is lower, this pressure is higher. We don't want the blood to flow back from the aorta or the pulmonary artery, so we need to close these semilunar valves. And that's happens right there. That's gonna be our valve closing. That's gonna be our let's see. That's gonna be our semilunar valve closing, and it also shows ventricular relaxation right here. Right here. And from there we have a slope right here. That's going to be our Y slope. This Y slope, meaning the pressure inside the atria is going down again. That means the blood inside the atria is going down into the ventricles. So blood from the atria is coming down into the ventricles. That's a passive filling right here that's happening. So we have Y slope that shows passive filling into the ventricles right here, passive filling. And also the V wave, which shows ventricular relaxation. It's going to demonstrate T wave on the EKG. And the cycle repeats after that. Goes back, and then we have atrial contraction again. The cycle repeats itself. If you look at the left ventricle waveform, it's pretty simple. You have an upstroke right here. It doesn't have any specific letters to it. The raise in the pressure is from the preload coming into the ventricles from the atrial contraction, and then this upstroke is from ventricular contraction, and it goes up to like 120s on a normal person and comes down to 0. 4 to 10 is the normal left ventricular end diastolic pressure, so it can come down to like 4 or even 10 to 4 to 10 millimeters of mercury. And the cycle repeats. Aorta on the other side, aortic pressure, it's always between the diastolic pressure inside aorta is like 70 to 80. That's your normal blood pressure. So it's going to be between 70 to 80 millimeters of mercury. And when the ventricles contract, the valve opens up, and then it increases the pressure inside the aorta because of the ventricular contraction. And right here you see a notch right here. That's when the semilunar valve closes. Dub, semilunar valve closes, and ventricles are going to diastole. This slight upstroke in the atrial waveform is from the pressure that the semilunar valve closing, and then it comes down to like 70s or 80s. If we have a pulmonary artery waveform, it's gonna look similar to the aortic waveform, but it's gonna be lower pressure. It's gonna be between 25 and 15 to 25. So we have upstroke right here up to 25, and then we have a dicrotic notch right there, and then we would go down again. So this would show the pulmonary valve closing, the dicrotic notch, and this is going to be the right ventricular contraction happening. Goes down. Normal pulmonary artery pressure is going to be between 15 to 25 over 10 to 15. That's it. If you look at the atrial waveform, like I mentioned, we have a couple different A, C, V. We have large V waves when we have mitral valve regurgitation. Why? Or tricuspid valve regurgitation, or mitral valve regurgitation, or septal valve rupture. This is your atrial filling. This is what atria has before it contracts. Is this point it hasn't opened up the valve to passively fill the ventricles. So at this time, if there's a mitral valve regurgitation, or if we have blood backing up to the atria, this pressure would be higher because there is pressure pushing back into the atria. So you will see large V waves on mitral valve or tricuspid valve regurgitation, or septal wall rupture, where you have your septum ruptured and then you have blood coming from the left ventricle to the right ventricle, so the pressure inside the right ventricle goes up, and then you will see large V wave. If you wedge, so if you have a pulmonary catheter which goes through your right IJ, or brachial or femoral or subclavian vein, goes into the right side of the heart via superior vena cava to the right atrium, to the right ventricle, into the pulmonary artery. That's how we get all these pressure waveforms. But if you inflate the balloon further, it would go and it would occlude the pulmonary capillaries, and it would read the pressures from the left atrium. How so, right? So if you think about it, the pulmonary artery goes out and it goes into capillaries, and it goes into pulmonary veins, and goes into lungs, and from lungs it would come back oxygenated to the left atrium. So if you're occluding the capillaries, and if you're measuring the pressure there, it's actually measuring the pressure from all the way over here on left atrium. So if you have a left pulmonary artery occlusive pressure, or pulmonary artery wedge pressure, that's going to be it's going to be equal to your left atrial filling pressure. So left atrial, however much blood is in the, or pressure is in the left atrium, that's going to be represented by the pulmonary arterial occlusive pressure, POP. And then left ventricular end diastolic pressure would be equal to your pulmonary artery diastolic pressure. So if your diastolic pressure of pulmonary artery is 25/10, if you think about it, your artery is relaxing, and if you come back the way that we did earlier, the whole system here is relaxing, and the valve would be open at this time, passive filling, things like that. So it's directly measuring the wave, the pressure from the left ventricle back to the pulmonary artery. So your pulmonary artery diastolic pressure will be equal to left ventricular end diastolic pressure. It's usually between 4 to 12. I think that's all I have.